If your child is seeing spots, squiggly lines, or what looks like tiny cobwebs floating in their vision, you're probably wondering whether this is completely normal or something to worry about. Here's the thing. When your child first mentioned these strange shapes moving around in their vision, it can be unsettling. And the worst part is, when you search online, you get everything from "it's completely harmless" to "it could be a sign of retinal detachment." So, which is it? I'm Syafiq, an optometrist. Over the years, I've seen hundreds of parents walk through my clinic worried about floaters, and I want to share what I tell them in the consultation room. Well, by the end of this video, you'll know exactly when eye floaters are harmless and where they signal something serious. I'll also give you a simple checklist every parents need to have on hand to protect their child's eyesight. Let's dive in. Okay, so first up, what are floaters? Think of your child's eyes like a snow globe. Inside the snow globe is a clear jelly-like substance called the vitreous humor. It fills about 80% of the eyeball and helps maintain the eye shape. Now, as children grow, or sometimes just naturally, tiny clumps or strands can form in this jelly-like substance. When light enters the eye, these clumps cast shadows on the retina at the back of the eye, and that's what your child sees as floaters. These can look like black or gray specks, squiggly lines, thread-like strands, or even cobwebs drifting across their vision. And here's the biggest sign of them. They move when your child moves their eyes, and they seem to dart away when they try to look at them directly. The reason floaters seems to float and drift is that they're literally suspended in the gel-like substance inside the eye. So, when your child moves their eyes, the gel moves too, and the floaters move with it. It's like all those little particles in a snow globe when you shake it. The truth is, in most cases, floaters in children are completely harmless. They're actually more common than you think. Your child might notice them more when they're looking at something bright and plain, like a white wall, a blue sky, or a computer screen. That's because the contrast makes them easier to see, not because they're getting worse. Floaters are also especially common in children who are short-sighted or have myopia, which is actually one of the reasons I'm so focused on myopia management in my practice. They're also typical for anyone who has undergone eye surgery in the past. Sometimes it's simply a part of their normal eye development as the vitreous gel naturally changes over time. But in most cases, children adapt quite well. Their brain learns to ignore the floaters and they become less noticeable. It's similar to how you stop noticing your nose in your field of vision. Your brain just filters it out. This is why many floaters don't require any treatment at all. The brain does the work naturally. Now, while most floaters are harmless, there are specific warning signs that mean you need to act quickly. And I want to be crystal clear about this because timing matters when it comes to protecting your child's vision. Start with this checklist. You need to see an eye doctor immediately, and I mean within 24 hours, if your child experiences any of these red flags. Red flag number 1, a sudden shower of floaters. I'm not talking about 1 or 2 floaters that have been there for a while, but a sudden increase, like dozens appearing all at once. This can indicate something called a posterior vitreous detachment, where the vitreous gel is pulling away from the retina. Red flag 2, flashes of light. If your child reports seeing flashes of light, especially in their peripheral vision, they may describe it as something like someone's taking a photo with a flash inside their eye. This happens when the vitreous is tugging on the retina, and it's a warning sign that shouldn't be ignored. Red flag 3, a shadow or curtain in their vision. If your child says it feels like a shadow, dark curtain or veil is coming across part of their vision, this could indicate a retinal tear or detachment, which is an emergency. Red flag 4, any combinations of the above. If these symptoms appear together suddenly, it's even more urgent. So don't delay getting immediate medical attention. The reason these symptoms are concerning is that they usually signal retinal detachment. What does this mean? Well, think of the retina as a wallpaper lining at the back of your child's eye. If that wallpaper starts peeling away from the wall, it can't function properly, and your child could lose vision in that eye permanently if not treated quickly. The good news is that when they're caught early, retinal tears and detachment can often be treated successfully. There are also other less common but serious causes of floaters like eye infections, inflammation inside the eye called uveitis, and bleeding inside the eye, especially if your child has diabetes or has had any eye trauma. This is why a proper eye examination is so important when symptoms are sudden or severe. Now, if you're thinking, but how do I know when to act? Let me give you a simple framework to help you decide what to do if your child reports floaters. Immediate action is needed within 24 hours if they describe the floaters as sudden increase in floaters, flashes of light, shadow or curtain in vision, or loss of peripheral vision. In these cases, call an eye doctor immediately or go to an emergency department. If your child reports any of the following symptoms, a routine appointment should be booked with your optometrist within 1 or 2 weeks. A few floaters that have been there for a while, no flashes or vision loss, or floaters are annoying but not changing. Finally, monitoring at home is fine if your child reports any of these symptoms. 1 or 2 occasional floaters, no other symptoms, and vision is clear otherwise. In these cases, keep an eye on the situation and mention it at your child's next regular eye exam. And as a general rule, children should have comprehensive eye exams every 2 to 3 years if everything's healthy, and every 6 to 12 months if they have myopia or other risk factors. These regular checks catch issues early before they become problems. So remember to book them in. If all this seems like a lot to remember, the biggest takeaway is that floaters are usually harmless, especially if they've been there for a while and aren't changing. But if your child suddenly sees a shower of floaters, flashes of light, or a shadow in their vision, that's an emergency and you should seek immediate medical attention. If your child has myopia or you're concerned about their vision worsening, I've created a free community for parents focused on children's eye health. To find out more and to join us, you can find the link in the description down below. And if you found this helpful, subscribe to the channel because I'll be covering more topics on protecting your child's eyesight. Thanks for watching and see you in the next one. Bye-bye.